If you had an audience with every single healthcare consumer in the United States and you had a microphone, what would you tell them? What is their best way to impact healthcare for the positive by taking some type of an action?
Well, if you talk about every healthcare consumer, that's all of America. So it's a
Mm-hmm.
pretty big audience that I'm talking to. And
Billboards across the country. What's your message to
my
people?
message to people, um, I think,
And this is putting you on the spot here.
yeah,
So, like I said, I've never done this.
you are, and so forgive me if I think for a minute here, but I probably, well, I mean, there's got to be some personal accountability. You can't just expect to waltz into a doctor's office after not taking care of your body for 20 years and expect some kind of magical fix. So I think to some extent you need to understand the consequences of behavior and your actions and your long-term health. But that said, I think everybody is entitled to be treated fairly and appropriately and have access to health care. And I think we should, when I tell everybody in America, um, I also think I think there's also, but among a certain number of people, there's also an entitlement of like, I deserve every test. I deserve every, I've paid for all my health care. We didn't even get into this, but I've paid for all this healthcare. Therefore, I should get every test I need when I feel I'm sick. And I think maybe there's another side to this: is the expectations of the American consumer, probably expecting.
Separating insurance from healthcare.
Yeah,
Yep, that's a good
yeah.
one.
I think there's another piece of that we haven't talked about. I'd encourage people towards the end of. I got a lot of billboards. I got a lot of messages to get out. I guess encourage people, later in life, probably advanced directives and really thinking about what it means to, what it means to die and what an appropriate death is, because we spend a massive amount of money in this country on the last 6 months of life. A lot of times because people are given this unrealistic expectation by the medical industrial complex that we can keep you alive forever. And unfortunately, part of being human is dying, and we all need to be able to recognize that and know what that means and be prepared for that. So I guess I got a lot of messages for America. I'm not sure anybody wants to hear my messages, but also, pro-vaccine, pro-public health. Don't throw public health under the bus. That kind of thing. I think it probably another message. Chris, you better get me off this very large soapbox quickly before America starts throwing tomatoes.
Throw your lifesaver here, Doc. No worries, no worries. No, good. Thanks for being a good sport.